What are the factors that affect drug metabolism? Well, you have genetic differences of cytochrome P450. You can have competitive inhibition of cytochrome P450. You can have direct inhibition. You can have induction. You can inhibit P-glycoprotein, and you can alter blood flow. So all of these things are going to affect the way that we metabolize our drugs. Now, racial factors affect cytochrome P450 activation. So for example, let's talk about 2D6. So 2D6 is one of the isoenzymes. It has 4 different phenotypes. There are the poor metabolizers. These are guys and men and women who have 2 inactive alleles. Then you have the intermediate metabolizers. These are heterozygotes. They inherited 1 active allele from their mother and perhaps an inactive allele from their father. So they have 1 active, 1 inactive allele, so they're heterozygotes. They have a moderate amount of activity. You have extensive metabolizers. So they inherited from each parent an active allele. So these are very extensive metabolizers. They'll bring down the drug level and convert it to the daughter drug very quickly. There's a 4th category. These are the ultra-rapid metabolizers. Some patients will have multiple copies of their genes that will code for very active cytochrome systems. Here's an example of what we're talking about. So this is a drug called nortriptyline. It's an antidepressant. And let's take a look at a person who has 0 functional 2D6 genes. There's the binding curve. Okay? Now let's look, it's a concentration curve. Now let's look at a concentration curve when a person has 1 functional gene, or 2 functional genes, or 3 functional genes, or in fact 13 functional genes. So the more functional genes for that 2D6 you have, the lower your drug level and the less active that drug is going to be in that body, and the more drug you need to prescribe for that person, or perhaps just use a different drug. Cytochrome is like a bridge, and imagine you're driving in a car. As long as the bridge is empty, you can drive across it very quick. 2 drugs may compete for that same pathway. So if you have too many cars trying to cross the bridge, it's going to take a long time getting across that bridge. 1 drug may actually inhibit the metabolism of another. So if you have a person who's driving really slow in a car, then even though there's not too many cars around, that 1 person can slow down an entire chain of cars. So that's what an inhibitor does on the cytochrome system. Now, 1 drug may induce the metabolism of another. So if you've ever seen ambulances, you always know that there's at least 1 idiot following the ambulance at a really high speed. That's like an induction enzyme. You've got 1 drug that makes the metabolism of another drug very quick. The opposite is true when the active drug is the metabolite. So I want you to imagine now that instead of having the active drug as the parent drug, you've got the active drug as the daughter drug. So a good example of that is codeine. Codeine is converted to an analog of morphine via this cytochrome system 2D6. So people who are fast metabolizers will have a much more potent, shorter-term response. So genetic factors that we talked about earlier with our plants are going to affect how we metabolize drugs. And a really good example is that let's take a look at patients who immigrate to the United States from ethnic Northern European countries. These patients, 10% of your ethnic European, Nordic American patients, will have little therapeutic effect from codeine. So you have to use higher doses of codeine or perhaps switch to actual morphine to treat them. On the other hand, when you take a look at patients from the African continent, 30% of your ethnic African American patients will be hypermetabolizers. So they will be exposed to excessively high levels of morphine when they take a small dose of codeine. Being aware of racial differences is very important, but also being aware of inhibitors of cytochrome system is important too. So I'm going to go through each of these drugs in detail. Amiodarone inhibits cytochrome. Fluconazole, which is an antifungal agent, inhibits cytochrome. Cimetidine, ritonavir, which is an HIV drug, and grapefruit juice are all inhibitors of cytochrome system. You should memorize this list. You need to know this list cold. Okay, so although I hate telling people to memorize lists without thinking about them, in this particular case, you need to memorize this without thinking about it because you need to be able to rattle off these drugs and, of course, grapefruit juice as inhibitors of cytochrome. Cytochrome P450 also has suicide inhibitors. So what's a suicide inhibitor? It means that it's permanently inhibiting things. So spironolactone, which is an antihypertensive agent, is a suicide inhibitor. Ethinyl estradiol, which is a hormone agent and is also used as a contraceptive agent, is one. Allopurinol is another. Propylthiouracil, which is an anti-thyroid medication, and secobarbital, which is an anti-epileptic. Now, I just want to mention something special about secobarbital. This anti-epileptic drug is always the one that trips up medical students, and it certainly got me when I wrote my exam, so I got this wrong. And we're going to spend a little bit of extra time on secobarbital and the other anti-epileptics with respect to the cytochrome system, and I'll show you why later. Once again, I want you to memorize this list of drugs. You need to know them for your exam, and honestly, you need to know them for clinical practice as well. Now, there are also inducers of cytochrome system, and I've put them in green so you can remember that they make things go faster. The prototypical inducer is rifampin. It is also the most powerful inducer. It's a drug that we almost never use in real-world clinical practice, but whenever you look at a drug, the first thing that will say on the drug interaction list is always rifampin, and it's used as a testing agent. Carbamazepine or Tegretol is used as an anti-seizure medication. Phenobarbital is an anti-seizure medication. Phenytoin or Dilantin is an anti-seizure medication. Ethanol is, of course, alcohol. And St. John's wort is a herbal product that has been particularly problematic for a lot of our patients. You should memorize this list. Now, I'd like to talk to you quickly about St. John's wort. St. John's wort is a herbal product that is used in the treatment of depression. It's somewhat effective. In fact, its effectiveness is greatly exaggerated by the press. But one of the most important things we need to know about St. John's wort is its effect on drugs. Now, people can die if they take St. John's wort in combination with their medication. Here's a paper that was released some time ago where heart transplant rejection occurred due to St. John's wort. So these patients who received heart transplants took St. John's wort, and it interacted with their anti-rejection medications, causing heart transplant rejection, in other words, death. So it's a terrible type of drug reaction that was caused by something that we weren't really aware of in the medical community. So it's always important when you're talking to your patients to get them to give you a list of the herbal products they take and preferably stop them all. Now, let's go back to that P-glycoprotein that we were talking about, the P-glycoprotein or MDR inhibitors. So we have a whole list of them. P-glycoprotein, I'm going to repeat this, is also called MDR1. It is a transport protein, and it moves drugs from outside the cell into cells or into intestinal lumen. Inhibiting MDR at the gene level causes toxic levels of a drug. So here are inhibitors of P-glycoprotein, verapamil, and grapefruit. And substrates of P-glycoprotein are cyclosporin and digoxin. So cyclosporin can be affected quite significantly by grapefruit or by verapamil. You need to memorize this list of P-glycoprotein or MDR1 inhibitors and substrates. Okay. So here's a list of everything. I want to just point out something about secobarbital and the anti-seizure medications. And when you take particular attention, the inducers are generally anti-seizure medications except for secobarbital, which is a suicide inhibitor. Okay? So all seizure medications, all anti-seizure medications are inducers of cytochrome. You can see carbamazepine, phenobarbital, phenytoin, and ethanol. Ethanol isn't really an anti-seizure med, but you know what I mean. Secobarbital is a suicide inhibitor. It is different. It's very important to remember that, and it's often things that trip up medical students. Okay, let's do a question. This is a drug interaction in the coronary care unit. A 55-year-old man was diagnosed with atrial fibrillation. His cardiologist prescribed verapamil. He was later found to have atrial fibrillation rhythm with a ventricular rate of 136 beats per minute. His nurse practitioner prescribed digoxin to help with his rate control. Which of the following is false? The verapamil and digoxin both cause a reduction in heart rate. B, the verapamil is metabolized through the same cytochrome P450 system and may interact based on a common final pathway. Verapamil is an MDR1 inhibitor and may result in digoxin toxicity. Or D, digoxin is cleared by the P-glycoprotein transport molecule, which is false. Well, let's look at our list and let's look at our answer. So the answer is B. This is wrong. The verapamil is metabolized through the same cytochrome P450 system and may interact based on a common final pathway. The truth is verapamil is an MDR1 inhibitor. It may result in digoxin toxicity. The mechanism of verapamil is to reduce blood pressure and reduce heart rate, and also digoxin will reduce heart rate, so A is correct, C is correct, and D is correct because digoxin is cleared by P-glycoprotein. Remember that P-glycoprotein and the MDR1 we're talking about the same thing. Let's look at another question, rifampin relevance, realizing rifampin relevance. I love alliterations, and you'll see that commonly throughout my lectures. A new drug is tested at Gargantua Pharmaceuticals. The scientist administers rifampin along with the new drug to look for the risk of drug reactions. The following is true, so pick one answer that's true. So the answer, it is induced by rifampin. So take a look at the question. You've got a lot of inhibited there. 2D6, 3A4, 3A5 is inhibited by rifampin, and then you have one answer that's induction, and then finally the fifth answer is PGP is induced by rifampin. Well, that's not true, and it's certainly not an inhibitor. Rifampin is an inducer of cytochrome, and it actually induces most of the isoenzymes. So the correct answer is D. Let's do a question on cytochrome isoenzymes. Which of the following cytochrome isoenzymes is the most active in metabolizing drugs? Is it 1A2? Is it 2C9, 2C19, 2D6, or 3A4 and 5? The answer is always 3A4 and 5. And when you're looking at an exam, 3A4 and 5 is going to be your answer. And when you're out in clinical practice, you're going to need to know if your drug is metabolized through 3A4 and 5, because almost certainly that patient's other drugs will be too. Okay, let's look at a question for inducers of cytochrome P450. Which of the following drugs is the most powerful inducer of cytochrome P450? Is it abciximab? Is it verapamil? Is it phenobarbital? Is it acetaminophen? Or is it rifampin? The answer is rifampin. So remember, rifampin is your prototypical inducer. It is also the most widespread inducer and the most powerful inducer. Let's do a question on a common problem. A 45-year-old male with epilepsy is placed on the cholesterol-lowering agent simvastatin. He returns with severe myalgias and elevated liver enzymes. You suspect that he developed statin toxicity. Which of these medications could be causing this? Could it be rifampin? Could it be carbamazepine? Could it be an increase in alcohol intake? Could it be phenytoin? Or could it be secobarbital? The answer is secobarbital. So remember that secobarbital is different from the other anti-seizure medications. Look at that. A suicide inhibitor, secobarbital. The other anti-seizure medications are inducers. Okay, let's do a question on suicide inhibitors of cytochrome P450. Which of the following is not a suicide inhibitor? Is it secobarbital, phenobarbital, ethinyl estradiol, spironolactone, or propylthiouracil? Good, you answered B, phenobarbital. It's really important to remember that you have a choice between secobarbital and phenobarbital, and secobarbital is a suicide inhibitor. It is one of those rare anti-seizure medications that is an inhibitor. Most other anti-seizure medications are inducers. The suicide inhibitors are allopurinol, ethinyl estradiol, propylthiouracil, and secobarbital, and I would definitely recommend that you memorize this list of drugs. Well, that's it. Thank you very much.